Is there a preferred opioid agent for chronic pain management in the geriatric population, either for reasons of effect or perhaps lack of side effects or lack of metabolites which might accumulate?
Yes, so of all the opioids that we have, we classify them into weak opioids and strong opioids. And weak opioids are codeine, which is in Tylenol, 2,3s, and or tramadol. The strong opioids are hydromorphone, oxycodone, or morphine, or fentanyl, or methadone. So of all these medications, when we see an elderly person, we have to see many things. How is the pain? If the pain is mild to moderate, or the pain is severe. Because if the pain is mild to moderate, we can go to one of the weak opioids. The weak opioids are meant to treat mild to moderate pain, and the strong opioids are meant to treat severe pain. But the weak opioids, the codeine, in the elderly population, they tend to cause more confusion, and they tend to cause more constipation. But if the person can tolerate it, that's a good medication. A lot of people in their 80s, 90s, if they don't have any liver problem, any kidney problem, they can metabolize and excrete these medications very well. And the other one that is similar is tramadol, but tramadol is usually not covered by the Ontario drug benefit plans. So unless if a person has work insurance or they have ways of paying for the medication, they would be also receiving tramadol. So these two weak opioids. If the option is to treat the pain with, because the pain is severe, or they already had tried a weak opioid and we are thinking about a strong opioid for the elderly population who usually have other comorbidities, their kidney function is impaired, not everybody, but usually, or their liver function is impaired, or they take many other medications that may interact with the opioids, so we have other options. So of all the three strong opioids, oxycodone, hydromorphone, or morphine, we tend to prefer hydromorphone because that doesn't have metabolites that will need to be metabolized to be active, has less interaction with other medications, so hydromorphone would be the first choice. But of course, the other opioids are also good choices for the elderly population, given that they don't interact with everything else that they may be taking. Anything else, Beth, that you'd like to add?
No, I think that's good.
Yeah.
Any comments, Sandra? Or? Oh, okay.